Welcome to my channel Brainies. Today we are going to discuss about the topic Dandy-Walker syndrome. Let us just see the Dandy-Walker malformation in detail. Dandy-Walker malformation, it is nothing but it is a congenital brain abnormality that primarily affects the development of the cerebellum and also the fluid-filled spaces. It is characterized by a range of structural abnormalities in the posterior fossa of the brain, which includes the hypoplasia or agenesis of cerebellar vermis, cystic dilatation of the fourth ventricle, enlargement of the posterior cranial fossa. So the basic concepts which is related to this Dandy-Walker syndrome, first thing is it is present at birth, that is it is a congenital condition which arises during fetal development. And the cerebellar abnormalities. The basic primary feature of Dandy-Walker syndrome is the underdevelopment or malformation of the cerebellum. That is a region which is situated at the back of the brain and which is responsible for coordination, balance, and fine motor skills. So this can lead to motor function problems. The next is the fourth ventricle issues. That is, there is often an enlargement of the fourth ventricle, one of the fluid-filled spaces within the brain. This can result in the accumulation of CSF fluid in the ventricles, thereby leading to hydrocephalus. The next is the communication issue. In some cases, there may be a cystic structure within the posterior fossa which may obstruct the normal flow of the cerebral spinal fluid, which can result in a non-communicating type of hydrocephalus. So, what are the causes of Dandy-Walker syndrome? The exact cause of Dandy-Walker malformation is not fully understood and it has not been clearly discovered. But however it can occur sporadically without a family history. The condition starts in the first month of pregnancy. As the baby brains develop, the cerebellum does not develop correctly and fluid begins to build up in the brain. So the possible causes of DWS includes the following: the chromosomal defects which can occur in people with trisomy 18, trisomy 13, trisomy 21 and trisomy 9. Certain viral infections that may pass from the pregnant person to the fetus, that is gestational diabetes, which occurs in 2% of pregnancies. Exposure of the unborn baby to certain toxins or medications. And the recessive genes may be responsible for this condition. These genes may cause cerebellar vermis hypoplasia, which is a small or underdeveloped cerebellum, and megacisternae magna, which is a larger cerebrospinal space. The types of Dandy-Walker malformation, it includes classic Dandy-Walker malformation, which is characterized by the presence of cystic structure. The next is a non-communicating Dandy-Walker variant, which involves the obstruction of the cerebrospinal fluid. And the next one is the megacisternae magna, which is a milder form of cisterna magna, which is not considered as a true Dandy-Walker malformation, but however it shares some of the features of it. The next is the clinical features of Dandy-Walker malformation. There's often an enlargement of the fourth ventricle, which is one of the fluid-filled spaces within the brain, and this can result in accumulation of CSF, thereby leading to hydrocephalus. Next is the absence of foramen of Luschka and foramen of Magendie. Dilatation of fourth ventricle occurs. There's an obstruction of cerebral aqueduct of Sylvius. Thinning of the occipital bone. The brainstem may be compressed. The sinus may be elevated above the lambdoid suture of the skull. Elevation of the straight sinus and also the tentorium cerebelli. Diagnosis is, it is typically diagnosed through imaging such as MRI, ultrasound, etc. So MRI can reveal the enlarged posterior fossa, cyst or fluid-filled space, dilated fourth ventricle, and of course hydrocephalus. Ultrasonic images can show signs of Dandy-Walker malformation. These images can reveal an enlarged posterior fossa and cystic structures in the brain. The next is a CT, that is computed tomography. CT scans may be used in some cases to visualize the structural abnormalities associated with Dandy-Walker malformation. Treatment. So let us just see the symptoms. These symptoms of Dandy-Walker malformation can vary widely among the individuals. But however it includes the developmental delays, the problems related to coordination, balance, muscle weakness, intellectual disabilities, and visual or hearing impairments. So these hydrocephalus related symptoms such as headaches and vomiting can also occur since it is correlated with the hydrocephalus. Treatment on a brief. The management of Dandy-Walker malformation, it depends upon the severity of the symptoms and the associated complications and clinical features. So treatments involve surgical intervention, that is to address the hydrocephalus, and physiotherapy, occupational therapy to manage the signs and symptoms, and ongoing monitoring by healthcare professionals. So it is a panel of team members, rehabilitation team members who handle the patients. Prognosis. The prognosis for individuals with Dandy-Walker malformation, it varies widely. Some individuals may lead very normal lifestyle with appropriate interventions and support, while others may experience significant challenges due to the severity and intensity of their condition. That's it with Dandy-Walker malformation. Thank you for watching. Kindly support by subscribing and sharing. Meet you all in next video. Thank you once again.